We have the next speaker, Dr. Rajeswari. You'll be speaking on the peeping through the red glow, angioid streaks. Do we have Dr. Tanvi, the last speaker? Absent.
Tanvi is absent.
Okay, thank you.
Good evening, everyone. Now we are talking about the case of angioid streaks. Before going to that, we have to know info about angioid streaks, which are the irregular crack-like dehiscence in the Brooks membrane associated with atrophic degeneration of overlying RPE. It appears as a narrow jagged lines deep to the retina, radiate out in a circinate pattern for peripapillary pigmentation, and these are associated with systemic conditions. Most commonly is pseudoxanthoma elasticum. And a 43-year-old female patient which attended to her OPD with chief complaints of defective vision in the left eye for the past 4 years and the right eye for the 3 months, and history of floaters since 2 months in both eyes. And the past history, it is a known case of hypertension for the past 2 years and no history of any trauma or head injury. And coming to the ocular examination, the vision of the right eye is 660 with pinhole improved to 612, and the left eye is 1/60, nil improvement in pinhole and glass. The near vision of right eye is +1 spherical. Oblique examination of the right eye shows lids normal, conjunctiva normal, cornea clear, anterior chamber normal depth, iris color pattern normal, and pupil reacting to the light, and the lens changes present. And the left eye shows normal except the pupil shows RAPD. Color vision of the right eye is normal and the field of vision of right eye is normal. The intraocular pressure measured by the applanation tonometer in sitting position, and patient was not on any anti-glaucoma medication. The right eye shows 20 mm Hg and the left eye shows 16 mm Hg. The fundus examination of the right eye shows media is hazy due to the lens changes, disc was normal, and cup disc ratio is 0.4:1, and vessels was normal. Apart from that, a narrow jagged lines deep to the retina was seen, and AV ratio was 2:3, and macula shows a chorioneovascular membrane, and FR shows dull, and background retina shows pre-retinal hemorrhages. And left eye media is hazy due to lens changes, disc was normal and 0.3:1, and here also the vessel shows narrow jagged lines deep to the retina, and AV ratio 2:3, and macula shows scar, and background shows chorioretinal atrophy with scarring. This is the fundus picture of the right eye, which shows chorioneovascular membrane and the angioid streaks, and the left eye shows the angioid streaks and the disciform scar. This is the OCT picture of the right eye and the left eye. This is the FFA finding of the right eye and the left eye, which shows disciform scar. Now our diagnosis is the right eye CNVM with angioid streaks and the left eye macular scar. The discussion of my case was angioid streaks are the distinctive fundus lesions that are associated with systemic disorders in 50% of cases. The most commonly associated disorders include pseudoxanthoma elasticum, Paget's disease, and hemoglobinopathies. Angioid streaks themselves are usually asymptomatic, but the occurrence of CNVM and macular degeneration can cause devastating visual loss. The streaks represent the breaks in the calcified and thickened Brooks membrane, and laser photocoagulation may be the beneficial to treat the CNVM associated with the angioid streaks. However, the recurrence rate is high. Thank you.
So basically, angioid streak, you have to see for the CNVM also, for the treatment and prognostic point of view.
Yes, sir.
No? Oh.
Thank you.
Okay.
Thank you.
Thank you very much.